You could just dim those lights now.
All right. Well, good evening, one. Thanks everyone for coming tonight. So I want to welcome you, excuse me, and thank you all for coming to the Thunder Bay Public Library's first community conversation event. My name is Dr. Richard Togman, CEO of the Thunder Bay Public Library. The Thunder Bay Library would like to pay respect and acknowledge our local Indigenous authorities. We'd like to acknowledge the traditional custodians and stewards of Fort William First Nation within the Robinson-Superior Treaty of 1850, and all of the sacred Anishinaabe grandmothers, grandfathers, elders, youth, and members who have come before us and have carefully guarded the land and all that it provides. We also acknowledge the contributions to our community by the Métis people. TBPL is committed to working with and understanding the history that has brought us to reside on this land and acknowledge our responsibility as treaty partners to provide access, accessibility, and assistance to anyone wishing to use library services or spaces. Now, this series of events are designed to get us talking as a community about the issues most important to local life. Engaging local leaders with community members is a fantastic start to deeper conversations, and there's no more important conversation than safety. Everyone, regardless of age, income, or background, needs and deserves to feel safe. For our economy to thrive, for our community to grow, and for creating a world where we are proud to raise our children, we need new, effective, and innovative approaches to achieving safety for all. Right now, Thunder Bay is not safe for many of us. Thunder Bay's violent crime severity index is 56% higher than the provincial average, while the overall crime rate is 34% higher. Our murder rate is 12.05 per 100,000, almost 10 times higher than the national average. According to the 2022 Citizen Satisfaction Survey, less than 30% of people strongly agree that they feel safe letting their children play outside in their neighborhood. Our youth are most pessimistic, with only 20% strongly agreeing that Thunder Bay is a relatively safe city. Now, these issues are exacerbated for those who are marginalized and those who face discrimination. Nationally, Indigenous and racialized Canadians are more likely to be victims of crime and homicide. The homicide rate for Indigenous people is nearly 7 times higher than non-Indigenous people. In Thunder Bay, those who report experiencing racism feel particularly unsafe. Only 5% of those who experience racism report strongly agreeing that Thunder Bay is a relatively safe city, and only 9% feel safe walking home alone after dark. Now, the panel before you have come to share in our conversations about what it means for Thunder Bay to be a safe city and the road to get there. I'd like to thank Fort William First Nation Chief Michele Solomon, Police Chief Darcy Fleury, Elevate's Executive Director Holly Gauvin, and the CEO of Canadian Mental Health Association Thunder Bay, Jennifer Hyslop, for joining us tonight. Now, Mayor Boschkoff had committed to attending tonight, but I've been informed by his assistant that circumstances have arisen that have impacted his availability for the evening. So unfortunately, he won't be joining us. Now, a few housekeeping items. The bathrooms are on the lower level. If you go down the stairs and to the right, you'll find the public washrooms. Emergency exits are outside the front door here and the side there. And please check your cell phones. Right? We're having relatively serious and important conversations tonight, and so please put them on silent or mute them for the evening. Now, as well, for everyone in the audience to be aware that this event is being recorded and live streamed and will be put online after. So if you do choose to go to the microphone in the second half of the evening, just know that your question and response may be recorded. Also, please hold any comments or questions to the second half. That will be when our public mic event will happen. The first half is for the moderated series of questions. And just to remind everyone to be respectful, right? Everyone is here to learn and to share, and we're all partaking in this community conversation together. So these questions are deeply impactful to the community, and so just try to keep a respectful perspective as we go about the evening. Now, the first portion will be moderated by myself, and I'll be asking panel members selected questions gathered from the community. Panelists will be asked to respond to the question and to each other's answers. Right? This is about a conversation, not a debate. Right? The second half of the evening will allow community members to approach the microphone and ask their own questions directly. So members of the public will have a maximum of 30 seconds to ask questions of a specific member of the panel, and then other panelists can choose if they want to respond to that as well. Now, before we begin, I'd like to ask everyone here today to share a moment of silence to acknowledge the lives lost and the trauma endured by those most affected by issues of insecurity related to violence, crime, mental illness, addiction, homelessness, and discrimination. All right, thank you. Now, the context for tonight is Thunder Bay and what we can do locally. We know these issues are bigger than our city, but we can't control other levels of government or outside organizations. This conversation is really about how we can take it upon ourselves to work together and find local, innovative solutions. So the task we set ourselves before us tonight is to push the conversation forward around what we can do and not what we should wait for or who else may be to blame. Now, with that spirit in mind, I'd like to ask the first question for our panel tonight about what does public safety mean to you? So, Michele Solomon, would you like to lead us off?
No. No, absolutely. I guess when I think of public safety, I think of, the opportunity for all members of the society to feel safe in their community, and that there's safe spaces for everybody to be. And I think that sometimes the idea is out there that it's what I would consider the most vulnerable that make our city unsafe, when in fact those folks are probably the most unsafe in the community. So it really means having a safe place for all of Thunder Bay public.
So for me, it would be an environment or a city that's free of things like stigma, racism, sexism, genderism, ableism, healthism, misogyny. All of these things give people license to treat people with less dignity, less respect, and make those people feel as if they are less than and less deserving. And that just isn't okay. It also gives people license to do harm to others. And all you have to do is consider the recent state of emergency with respect to domestic violence as evidence of that. So when I think of a safe community, that's what I think of, is that these things are just not present.
I would echo with what my two colleagues have said up here. It really is about safe spaces for everybody in our community, the marginalized and those of us who live without facing that. It's well-being. It's back to what Holly just said, how we respond to emergencies like domestic violence, like the outcomes of racism and the violence. So I would echo what my two colleagues have said.
I like going last because it's kind of like a grade 8 English assignment. Let them go first. I can just use their answers. Actually, no. So very, very much at the very beginning, what you mentioned there about the survey itself, we had 30% of our population. I don't know if you said the year, but 30% of our population thought they were safe to go walking in the streets with their kids and their grandparents and whatever. I think that's a real call for us to pay attention to that. And when we're talking about safety and how a safe community, it is that sense. It's how you feel about going into your community, how you feel about going to the stores, how do you feel about shopping locally, that kind of stuff, and really the sense that you have, not only for yourself, but also for the others. And there are a lot of people in this community that are in bad ways, but there's also a lot of people in this community that are taking advantage of those people. So I think the safety also has to come from addressing those, like all around, a full global picture of where the harm is, who's conducting that harm on an enforcement side for us, and how we engage those people and work towards getting those people who are in a bad way to a healthier lifestyle, and addressing those people who are keeping them in that lifestyle. So that's what I see as an enforcement piece on safety.
Great. Yeah, thank you all for setting the stage with that. Now, next question we've got from the community is a question related to who is, in your opinion, who is most at risk? And do you think a fair share of our public resources are being spent on increasing the security of the most insecure? Jennifer, would you like to address that first?
Sure, thank you, Richard. Who's most at risk? I believe strongly that, we've talked about marginalized people in our community, Indigenous people in our community, two-spirited LGBTQS are very much at risk in our community. As Holly said so aptly in her interview, that these are victims, not villains, the folks that we see who are really marginalized and homeless and struggling out there. I think there's always more effective ways to spend money. It's like the white elephant, I guess, and I can't tell the city admin where to spend money, but I think that we can continue to strive for better ways, more responsive ways to respond to these needs that are coming from the community. Communities, folks have had some really good ideas over the last number of years, and I think we just need to put some of those things in action and not keep waiting, because we're in a crisis in our city right now. Thank you.
So like Jennifer, we're of the same mind on this. I look especially at the rhetoric that's coming out of some governments lately about the 2S LGBTQ community, and they are very much under attack right now, and we're going to continue to see that become an issue as we move into our next political cycle. Indigenous people in our community have long been left behind and continue to be left behind, both systemically and financially. And our youth are getting caught up more and more with predators. Frankly, they're predators, and that's to what police chief was talking about, that there are some people who are doing harm in our community and are not victims, but are actually perpetrators. And so those are the communities that have me up at night. As far as the city administration and spending, I have no problem telling them how to spend money. No problem. I was very deeply appreciative last year. They decided to take a human rights-based approach to dealing with homeless encampments. We're one of the many organizations that respond to homeless people in our city. I thought that was such a great show in that many other communities, including Montreal, Halifax, Vancouver, were clearing people out with bulldozers and police officers, and ours said, no, that's not how we're going to do it this year. So that was great. This year they committed, I think it was about $20,000 to assist. The height of the crisis this summer, we've had 160 people in the homeless encampments, and I struggle. I absolutely love the art gallery. But we earmarked $50 million towards the art gallery, but $20,000 to help over 160 people in our homeless encampments. And so I really struggle with that, because there's arguments, whatever you believe, people are homeless for whatever reason you believe they're homeless. It doesn't really matter. At the end of the day, we all know this is not great. It's not good for our community. It's not healthy. And none of us are really happy about the situation. And so, yeah, I don't mind telling the city that they could do better.
I want to say thank you to the people who, work on the front lines and bear witness to this every day. And I haven't done that in a long time. But, I do feel strongly and would say that for me, I feel like Indigenous people are certainly at highest risk. And, I think about the experience of Indigenous people who come here for various reasons. They come here, for a better life because they live in communities that don't have services, don't have hospitals, don't have safe drinking water, or they don't have access to sports for their children, or they come here for medical reasons. There's a lot of reasons why Indigenous people end up in Thunder Bay, and the city is not always very kind to Indigenous people. In fact, we know that there's a serious issue of systemic racism, and that Indigenous people are often targeted because of systemic racism. So that's, in addition to, of course, other marginalized groups, but certainly Indigenous people, in my mind, are the most at risk and most vulnerable in this community.
So yeah, I kind of go along with what the ladies have said about the marginalized and the vulnerable people. I think they are significantly at risk with some of the lifestyles that they've fallen into. I think it's also when I do my town halls and I go across the community and I visit different groups of people, I've heard it time and again that when we have people in broad daylight having shootouts in an apartment building, that's not a good thing. That's a very concerning piece for the safety of our people. We talk about home takeovers and people that, again, are a bit vulnerable and are living in those lifestyles where people are coming in and basically running their lives. I think that's also goes back to some of the high-risk cases that they're involved with and the people that they're associating with. So those are very vulnerable people. So overall, I think we have to look at it on a very broad lens. We have some very concerning pieces that we have to pay attention to as far as those people that are being targeted. But we also, as an enforcement agency, we have to really look at everything in total and see how we can manage some of the more dangerous activity of these people.
Thank you. Yeah, so with that in mind, it actually leads very nicely into our next question from the public, where according to previous police statements, the violence and murders in our community are not random, as most violent crime are committed by individuals who know each other. So with this in mind, how do you understand the broader context of public safety in our community?
I'll start. That way they don't think I'm cheating all the time. So this goes, I'm not sure, I think it was Jennifer that said about the family violence family violence situation. This is, I think, was just declared a sort of a real problem for us here in the last week or so. And I think when you look at that and when you talk about homicides, statistically, if you go across the country, you're going to find that the majority of homicides are from somebody that you know. And oftentimes there is a family connection. So I think that's something that needs to be addressed. When we talk about our enforcement strategies, we look at the guns and gangs, which is a real problem for us. And what behind that are fast approaching is the family violence situation and how we can get some awareness on that and a bit of prevention down the road and focus on that. I think that's part of the areas that we need to look at.
I echo that. How's that? No, I agree wholeheartedly that, certainly the gangs in the presence in our community. I mean, we see the outcomes of that around, human trafficking of young women and really vulnerable young men. And intimate partner violence is a huge issue in our community, and we do need to get better at prevention and addressing so that there's safety for women and their children.
So just to echo some of what Michele was saying earlier, I strongly agree about Indigenous people being particularly vulnerable, and particularly on this issue. When I think about the 30% that feel safe, I'm not 30%. I am a white middle-class woman with a car and a job, and I can walk my dog late at night in my neighborhood and feel just fine. And yeah, there are actually homeless encampments near where I live too, but I still feel just fine. I do not feel unsafe in my community, but I have one member in the hospital right now who may or may not make it. I have one member who got jumped and begged for them just not to take her medication or her ID. And I have another one who's a victim of a home takeover right now, and we're trying to sort out how we support her and her daughter through this. That's 3. Every one of them are Indigenous. And so we can't ignore the racial component to this, and the fact that, once again, systemically, our Indigenous community is not well supported in this city at really any level.
Yes, I've just been asked to remind the original question. So it was related to previous statements that the police have made that, in their opinion, the violence and murders in our community aren't random, as most violence is committed by individuals who know each other. So with this in mind, how do you understand the broader context of public safety?
yeah, certainly not random when I think about, sadly, the people from my community who have been murdered in the city of Thunder Bay. It was definitely targeted violence. And, I think about that situation and how that is slowly infiltrating into my own community of Fort William First Nation. And so, the addiction and mental health epidemic combined with the gang problem in Thunder Bay, combined with vulnerable population that don't seem to have a way to escape things, just really really increases the dangerous situation that exists out there for those most vulnerable. Even when we think about the domestic violence situation, there's not enough beds for people who are experiencing domestic violence in their homes to flee to, and then if you combine that with somebody who's experiencing substance use issues and you're in a domestic situation, well, you're not getting a bed in a domestic violence situation. You're pretty much stuck in that situation. There's nowhere for you to go. So, we've helped to create, I guess, a scenario because of the way we, because of the stigma that is attached to substance addiction. We really leave people in a position where there's no place for them to go.
All right, so on that note, the next question is that public safety is not merely an issue of crime, right? It involves dealing with the social determinants of health, like homelessness, addiction, mental health, poverty, racism, and discrimination. Right? So in your opinion, what role should our local government play in addressing these issues, and are they currently doing enough?
Yeah. This one is one that I thought long and hard on, and I still don't have a really elegant answer, and I'm just really afraid I'm going to swear a lot. So, yeah, I think probably one of the things that frustrated me the most is that we finally got a little bit of traction on basic income, right? Basic standard of living. So, some of us in the audience will remember when minimum wage meant the minimum that somebody could be paid and still afford to support their family. That's what minimum wage meant. That is not what minimum wage is today. It's the minimum amount I, as an employer, am legally allowed to pay somebody. So lots of this is what we're living through as a result of, people remember the Harris government. 21.6% cutback occurred in the 90s. And we're seeing a generation that came up under devastating, crippling poverty. People spending 80 and 90% of their day just looking for food, shelter, and safety. And we expect them to live better, to do better, and to reach for the stars and to be able to, go to school and get a job and all of those other things. So that's what we're seeing. We're seeing the results of that huge cutback. That cutback, by the way, the numbers haven't come back up yet to where they were in the 90s. So if you were living on ODSP or Ontario Works before, you still get less money today than you did back then, despite the money, what we're experiencing with inflation. How do I know this? I was living on welfare at the time of the cutback. I was living in social housing at the time of the cutback, and it almost gutted me. In fact, it landed me and my son in a homeless shelter, and that was devastating and took more than a year to get out of that situation, and a message that I never, ever forgot. So we're absolutely seeing so many of these issues are a result of poverty. But again, and I feel like I might be harping here, the most economically disadvantaged in our community continue to be Indigenous people, and that's a systemic issue. And think about that word. There's a system in place that continues to allow this and keep this in place. And how can we be at this point in our development as a society and not be pulling our hair out. When that basic income got gutted, when the Ford government came in, it was one of the first things he threw out. It was only happening in 2 communities. It was happening here and in Hamilton, 2 of the communities that are devastated. We are, frankly, Thunder Bay is a cautionary tale on many, many things that are related to poverty. And so we had this opportunity to, you know, maybe do some research to get some backing for this. And good things were happening. I can tell you good things were happening within my own organization, the people that I knew that were actually on that project. But it was one of the first things that got gutted, and it made it through the news cycle a couple of times. And a few advocacy groups sent out a few emails, and then I haven't heard anything since. So we're just kind of okay to roll over and accept that an entire group of people, an entire race of people, can just be swept to the side and left to do without. Yeah, I don't know if that answered the question, but I'm finished.
Sure. Yeah, so the original question, feel free to take off from whatever aspect of that or follow up on Holly's. But is that acknowledging that public safety isn't merely an issue of crime, right? It involves dealing with the social determinants of health and safety, homelessness, addiction, mental health, poverty, racism, and discrimination. So in your opinion, what role should our local government play in addressing these issues? And are they doing enough?
It's a really tough question. You know, I live in a First Nation, which is a little different from living in a municipality, and I know that to make the changes that are needed also involves, you know, asking taxpayers to dig a little deeper, or you know, something along that line. But I guess, you know, the thing that occurs to me in saying that is, you know, how do we examine our own privilege? What are we willing to give up so that somebody can have just a little bit? How much can we give up for somebody else to have basic income? You know, I guess I just feel like we always have to look at ourselves first when we're calling on government or others to stand up and take action. And I have to ask myself, well, what's my part in all of this? So yeah, are they doing enough? There could always be more done, but the community has to be willing to look at what they could live without in order for that to happen.
Excellent point, Michele. I was thinking as you were both speaking, you know, 2 things jumped into my mind. I saw how the city pulled together during COVID, and we created all these shelters that were supported, and people had a place to go. They were staffed. And then COVID ended, and all of that support ended. And yet, those are the people you see on the streets. And there's even more now since COVID, because people were living marginalized to start with, maybe had a fairly low-paying job working in a bar or somewhere in you know, retail, got laid off. And I know so many people through the work that we do who have lost everything and are homeless now, and they're living in the encampments and in the shelter with their children because they really couldn't make ends meet. So that really dawned on me. And then Michele's point about, yeah, what am I prepared to do? And this may be inappropriate, but I'm going to say it. So for me, it's, as taxpayers, asking ourselves the tough questions. So what struck me lately is the decision that City Council was making regarding rinks, outdoor rinks in our community. Why would we make a decision that's going to further impact marginalized families and their children, and only support, say, those who could really afford high-level hockey? Sports, early childhood experiences, engaging with peers, community activities are critical to development, and yet why would we consider closing community rinks where children and families can go and be together and learn, form friendships, form alliances to support each other. So that's my comment.
So on this question, I'll suggest that we will be answering this question for the next few years. It's one of those questions that just is going to be continually there, because if we get more, we do more. What can we do next year? What can we do the year after? So as far as the enforcement piece goes, I'm pretty sure everybody knows you have 2 counselors on the police board. The mayor and another counselor sit on that board. We work very closely together to develop our objectives and our priorities for the next few years. And a large part of that is working with all the different agencies that are engaged in these areas, like housing and mental wellness and mental health, addictions, all that kind of thing. So we work very closely to come up with plans and ideas on how we can best use our resources that we have now. So I think, yes, we are working well together, and things are happening at the municipal level. And not only that, but we also work very closely to have conversations with our provincial and federal MPs and MPPs as well, to seek out other opportunities for funding as far as enforcement goes. But that always includes, and every message that we pass on as we go along is we have to do it together. There's no way we'll ever enforce ourselves out of some of the things that are going on. We need to work together to find ways to get people out of these unhealthy lifestyles and better ways to manage how they're going to go on in their lives. So I think that's something that I have seen since I've been here, is that we do work very closely together. It's ongoing, it's continuous, and it's hard work. But the next phase of what we want to do is work with the agencies and sit down and really come together with a really solid plan on the resources that we have now and what can we do as we go forward to push our program together.
Following up on that, I think a good next question relates to the Thunder Bay Police 2021 annual report, which states that the opioid crisis and the mental health illness are 2 of the largest drivers of calls for service. Additionally, according to Statistics Canada and the Thunder Bay Police reports, at least 75% of reported crimes are non-violent in nature. So given these facts, are the police shouldering too much of the burden of crisis response? And if so, does there need to be a reallocation of resources such that other potentially more appropriate organizations are better resourced to address these issues?
I'll start this one.
Okay.
So I've said it time and again, and you'll probably may have, if you've been to some of the meetings we've been at, I'll continue to say it. There's never any good idea in defunding the police. I don't think that's a really good idea across the board. I think there's a lot of issues that would come from that. But I think what we need to do is really fund as much as we possibly can, up to the point where the agencies are able to do the jobs that they need to do. So we've got to find ways to fund them, get those programs so that they have the abilities to manage some of the situations that we're dealing with. A lot of times when we go to a call, it may be a mental health call, and we end up, as a police service, managing that person the entire time, when really they may need to be triaged and put into a mental health situation or care, so that they can get the proper care that they need and move on with their treatments and a better lifestyle. So I think that's really important. I don't think we ever should talk about defunding the police, but we should definitely talk about making sure that our other agencies are funded as well, appropriately.
Sorry, Michele, were you going to go? I was going to say that CMHA has worked really closely with the Thunder Bay Police Service over the last number of years in response to this issue that police shoulder, so much responsibility for mental health and addictions related calls that they're not appropriate. So we have developed, what we have is called the Impact Team. I'm not sure if you've heard about it in the community. It's an integrated mobile crisis team where there's one police officer and a crisis response worker who respond to 911 calls related to mental health. And we've done some research with Lakehead University, and there has been a significant reduction in the amount of time that officers spend in the emergency department. 65% diversion rate from emergency department. People are cared for in community, whether it's care of themselves, with a family member, CMHA safe bed, or another option in community. So it decriminalizes mental illness, which is better for people who are experiencing mental health crisis. I don't know anybody who wants to sit in the emergency department these days. you know, and particularly if you're having you're in a serious mental health crisis, that is not a place where you want to be. So the more we can advocate for funding for programs like that to take the pressure off police and more appropriate community agencies respond, I think that the police can then focus on their job or what it should be, and you know, the community needs to step up and do the mental health and addictions work in a different way, so that we're not criminalizing mental illness and addiction.
I guess what I would add to that is there seems to have been an ongoing increase to the cost of policing, and I see that, or in my mind, that will continue to increase if we don't ever get to the business of treating mental health and substance use issues appropriately and meaningfully. You know, I had to make a call on behalf of somebody about a treatment bed yesterday, and the person requires 10 days of being substance-free before they can access a treatment bed. And, you know, I think to myself, if this person could do 10 days substance-free, then I probably wouldn't have a need to call the treatment facility. So, you know, it just, obviously, you know, we haven't been doing this right for a long time, because I worked in mental health and addictions, and I've been out of the field for, you know, a good 10 years now, and we are still insane, doing the same thing over and over again, getting the same result. Like, we're still doing the same things. We are still expecting people who have mental health issues and substance use issues to be this ideal treatment candidate, and the reality is we are just setting people up for failure, in my mind. So while I think everybody would like to see the cost of policing come down, I think that, you know, the way to get there is to make significant investments and long-standing investments in addressing mental health and addictions in a meaningful way, and then, you know, things may eventually look better. I mean, that's just my opinion, though. Thank you.
So I have a couple of thoughts. One of them is, first, I'm not in favor of defunding the police. Their job is to run towards the sound of danger. Mine is to get out of the way of danger. So not super fond of that idea. But what I would say is that we use police as a solution to everything, and they're just not. They're not. There's a reason why I do social work, and our police chief does police work. Each playing to our own skills, and the truth is that they have fielded numerous calls this year, last year, the last 4 years, from people whose only crime was that they were living homeless down the hill, around the corner, at the other end of the park, but I know they're there, and so I'm going to call the police, and the police are going to take time out of their schedule dealing with real crimes in order to address that. People, you know, might be consuming alcohol somewhere, and does it always necessitate a police phone call or a police presence? And I don't think it does. So I think that we use police way too often as a solution to things that we might even just have a conversation with somebody about, or we might be able to just learn to tolerate, which actually just leads to my other thought, which is that Vancouver has an interesting model, a community development model that they put into place in the downtown east side, where business owners and people who use substances, maybe people who are working in sex trade, that sort of thing, learn to coexist. And so it was about creating policies and ways of being in that community that were manageable for everybody. So it could be something like a sex trade worker maybe doesn't stand right in front of the Max Milk, but instead stands down the corner. But in exchange for that, if that sex worker goes running in there saying call 911, no questions asked, a phone call happens. And I say this because we had this happen with one of our community support workers over the weekend. There was an overdose, and she went to 3 different people, 2 people in a park and 1 person in a business, and not one of them would call 911 when it was needed. They all said, it's not my problem, it's not my business, I don't want anything to do with it, get out of here. And so this learning to peacefully coexist is an acknowledgement that there are some of these things that are never going to go away. We've heard, people in unhealthy situations or living unhealthy. For some of our people, they're never going to stop using. They're either unwilling or unable to stop using substances. They're unwilling or unable to take mental health medications that might stabilize their mental health, or there might not be any treatment for what's going on with them. They can't be simply swept aside or left behind. So we do need to learn some ways to coexist. And so I would be certainly interested in a model like that that is less dependent on police, puts social workers and healthcare providers in the front seat working with people with healthcare issues, and is pennies on the dollar. Would save a lot of resources, and again, still has me running away from the sound of danger and not towards it, so.
All right, thank you. So related to that, we know that homelessness has leapt in great visibility in Thunder Bay since the pandemic. Right? A severe shortage of affordable housing is plaguing our city. The Canadian Centre for Policy Alternatives has calculated that 0% of Thunder Bay's neighborhoods meet affordability criteria established by the Canadian Mortgage and Housing Association. 0%. So this means that someone working full-time on a minimum wage cannot afford a 1-bedroom apartment anywhere in the city. So what is the city's responsibility when it comes to homelessness? If no additional provincial or federal funding comes, what is the best solution for us to address this issue?
This question. The long and short of it is that there's nothing on the table right now, to be honest with you. We're continuing to grapple with it, and one of the reasons we're continuing to grapple with it is because we continue to fight a very old puritanical view of people who deserve and people who don't deserve, right? So we have the deserving poor and the undeserving poor, and so as long as we're still fighting that old fight, we're not going to come up with solutions. And particularly in this community, because this has been a polarizing and divisive issue, and is not likely to get better anytime soon. Fortunately, we do know there is some provincial funding coming. Theoretically, there's some federal funding coming. But those solutions are still at least, at best, a year and a half away. I still have almost 60 people in the homeless encampments right now that we're serving every day. That's a lot of people, and so even if we were to fill up all the beds that are available, there's still not enough beds to go around within our shelter system. So, I mean, the answer is housing for all. The answer is there needs to be an investment, and I guess the answer is something that is not at all going to be popular. Please don't call my office tomorrow, I won't be there. Yeah, the city should actually have some responsibility around this. I've heard for years, well, we don't do programs, we don't do services. We choose not to do that, right? Like, Toronto actually has homeless shelters that are city-run, city-funded, city-staffed. And so those are actually desirable jobs. I can tell you they're not particularly desirable jobs in our city when our people are working for $17 an hour. So just barely above the minimum wage and dealing with some really tough stuff because our communities have become, or our shelters have become a place where we can wrap up at 4:30 and say, it's okay, just go stay at the homeless shelter, they'll take care of you. And so here are these workers for $17 an hour taking care of things that we couldn't get done during our workday. And hospitals having do not readmit orders, and the best solution they have is to call the police. to come in and help support. These are not good solutions. This is going to continue to drive the homeless population. This is going to continue to drive people out onto the streets. And so the short answer is I honestly don't know what the answer is, and I've been doing this a really, really long time.
I don't have the answer either, but, you know, a few thoughts certainly occurred to me. Just on being creative. I mean, I think about the hospital 50/50 draw that, you know, is like $1 million every month, and, you know, maybe we need to divert our 50/50 to creating some housing for people, for maybe making housing out of some of these abandoned buildings, or these buildings that, you know, are just not being used by anybody for anything. And hospital do not readmit orders. I mean, I think I just want to say, you know, certainly there's been bright lights on the police for systemic racism, but systemic racism exists in all institutions, not just the police. So, you know, to know that, you know, the level of systemic racism that occurs in our hospital too, let's just make note of that. Thank you.
Well said, Michele. I think that what the city can do and should do, I mean, there's lots of evidence out there of successful models for keeping people housed. Housing First is one of them. Well-researched, highly successful. It's expensive, so it really is about walking with somebody in their journey in homelessness. And when they're ready to become housed, then we start the process. There's no strings attached to it. You don't have to promise to not drink, not use, get your mental health treated. It's highly successful, and you look at communities where Medicine Hat and other communities in Canada and across North America, it's highly successful. So I think investing in models like that are researched and they show really good outcomes for people. I think we had one out of all the individuals we housed through that program, they remain housed. And it's been very successful, but we need to magnify that by, like, how many do we have? So not just, I have 2 staff who do that work, but as a community, wouldn't that be amazing if we could coordinate and just on, I think Holly or comment around 24/7. I think we need to rebuild our system, the mental health and addiction system in our community and across the province. We can't go home at 4:30 and expect the police to deal with things, the shelters, my mobile crisis team, and I mean, there's nobody, and weekends is even worse. So as community service providers, we need to have those hard conversations about shifting when we work, where we work. Maybe we need to come and work in the library where people are going to show up. So we need to have some difficult conversation, I think.
Yeah, the only thing I'd add to that is exactly that. Thinking out of the box, maybe trying to find some other unique solutions, and actually talking to the people who are going through the homelessness crisis and seeing what they actually really do need, and having that conversation on a regular basis, and putting that back up through the system so that we could really get some grassroots examples of what they want to have.
Thank you. Now, we know that systemic racism is pervasive in our society and institutions, and we know that our own Thunder Bay Police have been investigated numerous times for racism and discrimination. Right? The OIPRD report, among others, have identified systemic racism in the police services, and the province still controls the Police Services Board, with the administrator's term being extended into March of next year. So what do the Thunder Bay Police need to do to regain the trust of those who are suffering most from insecurity and discrimination?
I could answer that, but I think I'd like to hear from everybody else first, and then I can just go ahead and do it, but I don't want to take, okay. So that whole idea of systemic racism, I think it's really important that we, number one, understand what that is. It's not the overt personal, the person being racist. It's the way that systems are put into place, it's the way our policies were put into place, it's the way legislation was put into place that accounts for some of the things that happen out there in the field. When we talk about systemic racism, the real onus is now on me. Coming into this position, if I allow a policy to go out there, a procedure, our officers to do something that could come across as being racist, that's on me. There's only one place where it lies, and that's me. So we're going right now through an entire review of our policies. We're scrubbing them down, we're going through everything that we do, and we're having a good look at anything in that policy that could come out and be racist, not intended, but it could lead to that. And what we're doing in that as well is we've hit the ground running with many of our Indigenous organizations, asking them to have a look at these policies to make sure that the language we're using isn't going to set up one of our officers for something that's going to be harmful down the road. So we're really working hard to do that. I've been here 6 months now, and I can tell you I took a very clear lens on racism. I've talked to the people that have been involved in our professional standards branch, and I asked them point blank, give me clear examples. If we have somebody's racist, they don't belong. And we don't have any tolerance for that. And that's the conversation that I've had since before I became chief, all the way up to today, and it'll continue that way. So if we find somebody who is overtly racist, they're not going to be in this position. We just can't have that. So we're working very hard. I mentioned it at several of our meetings. The number one priority for us is to rebuild that trust. And to have those, our Indigenous people that visit this community and live in this community, feel that they are safe to come here, and that they're part of the community, and that we'll do everything we can to ensure that they're safe. So all of those things, there's not just the police service. Again, going back with the board, we talk about this regularly. We just had a meeting, not this past Friday, the Friday before, with the OIPRD on the recommendations from their report. And we went through them one by one, and we scrubbed them down as to where we are. And we've done some really great things as far as an organization, and we're reporting those things back. I think, by the end of this year, we would have come a long, long way to answer those recommendations, and to make sure that the things that had been identified have been corrected or are well on their way to be corrected. And so I think we're doing a lot on that. I don't like to think that, for 1 second, that maybe there is somebody in the department that could have some racist tendencies that I don't know about. But eventually down the road, if they are truly that person, we'll find out and move on from that. But I just want to make sure that people understand it's not that we have an office full of racist people. That's not the case. It was just the way the systems were, and we're taking everything we can to correct that.
I would just like to pick up on, thank you, Chief Fleury, what Michele had said, that all systems, I mean, yes, that was very public for our city police, but I think as a leader of my organization, there is, we built our systems based on colonization, on, racism, on all kinds of really inappropriate things. So now as a leader, for me personally, it's looking at my organization and how we offer service through that lens of reconciliation, what is tolerated and what's not tolerated in my organization as well. So becoming an ally and how to be an ally and, know that the system, my system, that our organization is not perfect. But yeah, I think as organizations, we need to acknowledge what Michele had said and make efforts to make change.
So agreeing 100% and knowing that while we can be very, very critical of lots of other systems, we are still all part of that system. And so having to take that critical look at our own work, a number of years ago, we engaged in a research project that focused on Indigenous women. In 6 months of launching that research project, Indigenous women's participation had increased by 138%. So what the hell were we doing the last 20 years, right? So it really kind of started us down that path of looking at where else are we missing the boat? Where else are we creating systems that don't feel safe and don't feel welcome to Indigenous communities? And what do we need to do about that? And so that's gone, and we're on our own path of truth and reconciliation work. And I say I get it wrong more than I get it right, but we keep trying. It's all the way from the policy level to your staffing to everything, but it's up to all of us to be looking at that, to be looking at our organization, and to a point Jen made earlier about, we have these models that are really set up for workers and for employers. So 8:30 to 4:30, Monday to Friday, I love that life. But is that when crisis happens? Is that when our people need us? And so, yeah, I think that our policies set up some general barriers, but we also really do need to be, as organizations, looking at those systemic issues from when we founded our organizations that continue to uphold a white-centered thinking or a white-centric way of being in the world. And so that's a lot of work to unpack that, and it's a very, very hard road to walk, but I can assure you it'll be worth it.
I think, representation and privilege is really central to this question as well. I'm the chief of Fort William First Nation, and I don't speak for all Indigenous people. And so I know this is the first of many conversations, perhaps. So ensuring that, we have a broad spectrum of representation of Indigenous people to speak to these issues, but most importantly, the people who are experiencing the systems, the people who are experiences the systemic racism, what do they have to say about it? I can tell you I've had some really challenging experiences in my life as an Indigenous woman, both in my community and in the city of Thunder Bay. And today, to be representing my community in this way is I guess, I've said before that it's only second to being a mother and a grandmother for me. But I recognize that I too sit here today with privilege. And so I too sit here having a voice that doesn't represent everybody. And I really feel strongly that if we really want to know how to make things better, then I think we need to talk to the people who are experiencing the systemic racism and the discrimination and all of the isms in this community. So, miigwech.
All right. Our next question revolves around crime prevention through environmental design. It's a proven method to promote and cultivate safe neighborhoods. It focuses on the factors that make neighborhoods safe, as opposed to focusing on crime once it already exists. Building walkable neighborhoods with small local business and strong social bonds between neighbors are major contributors to public safety. However, many of our newer subdivisions are often built as car-dependent, socially isolated, and void of any opportunity for small local business to grow inside those neighborhoods. So in your opinion, how is the city's development planning ensuring that neighborhoods are safe now and in the future?
Just when you would miss the mayor.
Agreed.
Yeah, that's a tough one. I think really, again, going back to an enforcement piece, when you're talking about public safety by environmental design, really there's so much in that program that can benefit any community. As how you set up, how you set up, the way you plant your trees, the way you put the shrubs, how you align your roads, all of that type of thing. So I think this is a really difficult question to ask outside of somebody who's not a city planner. So I'm not sure if any of us would have an answer to that, other than it's a really great idea. There's a lot of good that comes with that type of system and doing that kind of a study. It really does focus on what we can do to make sure that our city is designed for safety. And really that's the only comment I have to that. Otherwise, yeah.
I honestly don't have a clue, but one question I have is, why do we keep wanting to tear down Victoriaville when that can be a hub for wellness in this community? I don't know. Like, I just think that we want to take away the spaces that people who are struggling gravitate to. And it's like, let's make them disappear. Let's make them invisible. Go somewhere else. I don't know what the answers is, but I know it raises more questions for me than answers. And so I'm going to leave it at that.
Yes, yes, yes. Thank you. Doing better than me. Any environmental design that doesn't make contingencies and plan for people to continue to use substances, people sometimes to struggle with intermittent homeless or sometimes long-term homelessness, anything that pushes people away and doesn't support a YIMBY instead of a NIMBY is a non-starter for our community. We're only going to end up back in this conversation again, right? It'll be throwing good money after bad. So I love the concept of a smaller neighborhood. I grew up in a smaller northern community, and we had those smaller neighborhoods, and it was lovely. People at the corner store knew if you went to buy a pack of smokes that you weren't old enough, and they ratted you out. They called your mom, right? And so those types of things were safety buffers, right? Like parents looking out for other people's kids, and we all got yelled at by other people's parents, right? So they were safety buffers, and so there's some really good things that can happen. And I love the idea of anything that supports our local business community, because it's our local business community that has our backs every day. But yeah, I really do struggle with this concept of, I hear sometimes family-friendly neighborhood, and I cringe because, that person who's using drugs on the corner, that person who's homeless is somebody's family too. And so to just dismiss them and they're not part of what we envision of family, we have this, I don't know whether it's Norman Rockwell or Leave It to Beaver sort of, thinking, this vision, which, by the way, the folks in the room who actually lived during that generation knew damn well that didn't exist, because the June Cleavers of the world were actually getting beat up regularly, right? But it was considered a private trouble and not a public issue. So I know I went off on a little bit of a rant there, but this is, when I saw that question, it felt like, you've got to be kidding me, because I feel like it goes back to that conversation that was held at City Council that we should plant some thorny bushes. That'll keep the homeless out. Well, guess what? My people sleep on thorny bushes every day and are thankful, because at least they feel safe for 5 minutes out of their day. So environmental designs that are meant to shut certain groups of people out are racist, are othering, are stigmatizing, and are absolutely unacceptable.
Yes.
Maybe the last question before we take a short break. So a major cause of death in our city is overdose, right? So according to the Thunder Bay District Health Unit, Thunder Bay's overdose rate from opioids is 122% higher than the provincial average. So what can be done at the local level to address this horrific situation?
Well, all right then. So many things. I mean, I'll always come back to this, and again, it feels like I'm harping a little bit, but, stigma and racism are at the heart of so much of this, as is poverty. And so we need to be seeking some immediate relief around poverty. We need to be destigmatizing drug use. And I know that's a really hard, forgive the pun, pill to swallow. That's a really, really difficult concept. Harm reduction doesn't mean I approve of what somebody's doing. What it says is, no matter what you're doing, I'll love you unconditionally, and I'm gonna stay beside you. I'm going to stand and I'm going to walk this path with you. And if you ever make any other choices, I'm going to walk that path with you too. I'm here to support you no matter what. Some people call it enabling. Yep, I absolutely enable people to reach the best possible health outcomes that they can in the situation that they're in. Proud of it, do it every day. And so yeah, reducing the stigma. Stigma is what's killing my people. Stigma is what's leading to people not reaching out and taking higher and higher risks with their substance use. It's what's creating an increase in infectious diseases. It's what's making those infectious diseases continue to spread and to get worse because people are afraid to reach out for help because stigma and discrimination will be brought upon them. And so we need to address those things. And until we do, until our community can accept and make room for people doing things that maybe they don't approve of, but at least just don't go out of your way to make somebody feel bad about it, right? Like that's the very least you can do as a human being is just not be rude, right? Just make room for other people. There's room for all of us in this community. So just make room and do that little piece that you can, which is not make people feel less than.
I agree wholeheartedly, Holly. I mean, we talk a lot about harm reduction, and that truly is the answer, and to do it without judgment. I always say that the people who are using, so if you think about it, mental health and addiction is an illness, it's a disease. And so why do we treat it differently than we treat cancer, diabetes? People you see using and struggling with mental illness, they're someone's daughter, son, grandmother, mother. So to look at them through a lens of kindness instead of judgment would go a really long way. When you see somebody struggling on the street, you know, how often do you stop and say, hey, are you okay? Do you need anything? It would do a lot of healing if all of us tried to do that.
Yeah, and for our part, it's basically, like I mentioned earlier, getting those people into the right agency to take care of them. And then let us concentrate on those people who are doing the supplying, the trafficking, and all that kind of stuff. So that's what we're going to focus our efforts on.
All right, so that will conclude the first half of the evening. We'll take a short 5-10 minute break, let people use the restrooms, take a drink of water, stretch your legs a little bit. We'll be coming back at 7:30 sharp and beginning the open mic public section of the evening. All right, thank you. All right, everyone, we're about to get started. All right, I think we'll get going just in the interest of time. I know the police chief was just got interrupted on his way to the restroom, so he'll be back momentarily. But if anyone has a question specifically for the police chief, we'll just kind of give him a minute, but otherwise we can begin. Just as a reminder before we launch off, please keep your questions short and concise, no more than 30 seconds, or I may be unfortunately interrupting you. And also please keep your questions respectful. Right, we're all here to share and learn. It's not the right time for ranting or diatribes. All right.
Do you need us to introduce ourselves at all, or?
If you feel comfortable, go ahead.
All right. Good evening. My name's Al Joseph. I work with the city. Our city's community safety and well-being plan talks about upstream investments. I'm just wondering if each of the panelists could, if money wasn't an issue, what is an upstream investment you would like to see in our community? And I'm thinking things like school lunch programs, things that are in place in a lot of other countries. Thank you.
Okay, answer.
Basic income, basic
yeah,
income,
basic
basic income.
Yeah. Housing, for sure. And yeah, the school lunches, I just read that article too, that Canada's one of the only, or the only G7 that doesn't have food programs for children and youth. It really was, wow.
Anyone else want to weigh in on that question?
I only heard half the question, but I think I got the answer. So what I'd like to see is a real solid crime prevention and awareness program, more like along the crime prevention, which could be like an after-school program where we see our youth starting from an early age and their families go into this program and work really hard to show them the harms of some of the things that are happening in this community right now, some of the risky lifestyles, and really put an emphasis really towards at-risk youth, kids that are already, maybe at risk to fall in this kind of thing, and really put an emphasis on that. And I think that'll go a long way to help in some of the issues that we have right now.
I have to agree with the basic income, but I can't waste this opportunity to say that clean drinking water in every First Nation would be really great.
All right.
Okay, I'm going to go really fast. In terms of public safety, I wanted to call for the reinvestigation of the 25 missing and murdered Indigenous women and girl cases that was present in the leaked report that came out last year. I also, on the 50-50 draw, I just want to say that the hospital still doesn't treat acute withdrawal in the hospital. So if you have chest pain, you can get treated, but for a non-fatal opioid overdose, you cannot. They will let you go in pain. My question is, as the mayor's moving for strong mayor powers, and just 4 days ago he stated in the media that he's willing to listen to anybody who even comes close to some kind of a solution for homelessness, and yet chose to go to the airport convention banquet this evening instead of attending this panel. How do you feel that will affect your working relationship with the mayor, who's the chair of the Thunder Bay District Social Services Administration Board and a member of the Police Services Board?
Oh, hell yeah. That's a question. That's a question. So first off, absolutely, missing and murdered Indigenous women, many of them were people that I know, many of them were people that I love. And I would love to see that reopened and reinvestigated. As far as strong mayor powers go, as far as my relationship with the mayor, the city declared Elevate the lead organization for homeless encampments. We did not declare that ourselves. We just said we're going to do outreach. We're going to go out every day. We're going to make sure people are fed and that they're linked to health and social services and housing. That's what we said we would do. We got declared the lead because we were going to do it consistently. I'm told in the media that the mayor is following the issue very, very closely, and yet he and I have never once had a conversation. I saw an awful lot of campaigning from city council members as well as the mayors in the mayoral race who spent a great deal of time taking selfies. I still see that happen today in the homeless encampments. And I gotta tell you, it's a non-starter for me. It's a non-starter for me. It is. It's absolutely shameful to be conducting yourself that way when you're a member of city council or a member of the mayor's office. I'm disappointed that he's not here tonight. I would have loved to have had a really robust debate or conversation around some of these issues and hopefully talk to him about some of the things that we're seeing on the ground as we speak, and to remind him that he's a mayor for everybody, not just property taxpayers. So yeah, I'm disappointed. How does the strong mayor powers affect my relationship with him? Well, I don't have a relationship with him, as he is, a member of the board of DSEP. It may affect my funding going forward, but I may or may not have a job tomorrow, and so I'm quite okay with that, because I think that unless we're okay having these really uncomfortable conversations and sometimes being held to account for things that we're not super proud of, I don't think anything is going to move forward in our city. We can't just sit around and pat each other on the back and pretend like everything's okay. It's not okay.
So I guess that's the experience that we all share differently, right? So as far as the second part of your question, the relationship with the mayor, we get along really good. We work really hard on the police service, with him being on the police services board. I mentioned earlier that some of the programs that we have lined up and that we have projected and have planned going forward, he's very supportive of those, always has been since I've arrived here. And the conversation around when we're trying to address all of the issues that we're talking about here tonight, he has shown me no other indication other than being in support of those. So I continue to work those avenues, trying to find ways to have, I mentioned it a few times tonight, have people that we deal with on a regular basis find the right stream so that we don't have to do it through an enforcement lens. And again, he's been very supportive of that idea, with the idea of we have a situation table here, it's called, and we want to put that into a full-blown community mobilization where all these agencies come together, we coordinate, we triage, we take the cases, we take the client, maybe they need shelter, maybe they need addiction counseling, whatever, and really push that envelope in the next year, 2, 3, 4, 5 years. And again, he's very, very supportive of that. So my experience compared to others obviously is very different with the mayor, and I think he has shown great support as to what our program is, which includes some of the programs that we're talking about here tonight. The other piece to that, when you talk about the 25 the cases that you want reinvestigated, this has, of course, been only for a short time. I do know that 13 cases have been already, I think it was news there, June or July. The OPP have taken another 13 cases and have reviewed those, or are in the process of reviewing those. So if there's further cases that need to be reviewed, I'm open to that.
Can I send you the leaked report?
Yeah, with the are you calling it a leaked report? Yeah. A leaked report from where?
From the OPP investigative team. That was sent. Everyone got it last year. Like, it's public now, but it was leaked, and it called for 25 other than those 13 to be reinvestigated over the last 10 years.
Yeah, send it to me. It's easy. Darcy.Fleury@thunderbaypolice.ca, and you're going to get me. I'll have a look at it. Yeah.
I guess, certainly in regards to missing and murdered Indigenous women and girls, if there's any case that has not been properly investigated, then it absolutely should be. Again, this is like off topic, but they should search the landfill in Manitoba. tomorrow is the annual Sisters in Spirit Vigil that happens annually. I don't recall the year that it started, but certainly it's an opportunity to stand with and acknowledge family members and loved ones of missing and murdered Indigenous women and girls. It's disappointing that if in fact the mayor has chosen to go to another event, then that is unfortunate, because this is a very important conversation, and it was difficult to come here knowing that I'm the only person representing Indigenous organizations, or I guess Indigenous people, and that can be a difficult place to be, because you want to make sure that you're getting it right, and you're not saying things or doing things that that don't represent those people living those experiences. So I'm saddened that he's not here to hear the dialogue and participate in it, but I'll reserve judgment, and miigwech.
Hi, my name's Steve Mantis, and I want to start by thanking the library and the panelists all for coming out tonight. You guys give me hope that we can have a better future. I've spent the last 40 years providing support to workers who have a disability from work. And what we see is isolation is what so many people face. And I've learned that by reducing that isolation, by being together, we're able to overcome more of our hurdles. I was involved in a pilot project in the Picton Blucher community 10 years ago. We got $6,000 from DSAB to support community engagement. The local people, mostly mums, planned activities throughout the week to support their families and their children. Crime in that neighborhood fell 35% over 1 year. For $6,000, what is our return on investment? Where are we putting our money that is going to have concrete results to create safety for all of us? How do we engage people in neighborhoods that have relationships ongoing every day? Thanks.
Thanks, Steve. That's a really poignant and powerful question. I appreciate how you linked isolation and relationships and what happened in the Picton Blucher area. And I think it's important to reflect that people who live in encampments also have relationships. That's their community. Those are their people. So often we look at homeless people and people who are, on the streets or suffering, that that they're alone, but they have relationships. They have a sense of belonging. They have social order. They have all of those things. So how do we include them in the conversation about engaging in creating something where there's a good return on whatever the investment's going to be? They need to guide those conversations for sure.
Anyone else want to jump in? Or?
No, I think you mentioned earlier, like the program, like have some programs for these communities and the youth in those communities, and give them an opportunity to do something outside of a non-healthy lifestyle.
So we actually do have some really amazing programs. PACE, which is just right downtown here, it provides just amazing services, and on a shoestring budget. My organization also provides a drop-in center that's open 5 days a week. We provide everything from running shoes to winter jackets to food and opportunities to engage in cultural activities, etc. And when we closed for the first time in 3 years to do staff training. We closed for half days. for a week straight. And we got a very upset phone call from a woman in the business community in our neighborhood saying, you don't know the impact when you guys are not open. And it was like, oh, okay, we do now, right? And so there is an impact. These programs do have an impact. And so, you know, Steve, your comments about like such a small investment, $6,000, like what a return on investment, right? And I know some of the questions were about where could we put the biggest bang for our buck, right? And these are the types of things. Alpha Court has a community center. I know CMHA has Clubhouse and has for decades now been a safe place for people to be where they're off the street, supported, and not being scrutinized. And so I think that, you know, investing in safer spaces all across the city, it's really a great way to go. But I really do like the neighborhood approach that you talked about. I feel like that's sometimes overlooked as an organization that's been referred to as a fringe organization, which I wear proudly. We often forget those grassroots approaches, and frankly, for my money, community-based organizations and grassroots groups are what's getting it done in our community. We're picking up. We're not dealing with the low-hanging fruit. We're getting to the root cause, right? And so that's radical in its approach. And so, yeah, those are wise returns on investment.
I'd like to also thank you guys for showing up here today, and Michele, being Tim Sinclair, Métis Nation of Ontario. Michele, you've done an amazing job so far the first few months that you've been chief. I told you when you first got elected that I was extremely happy to see that you got on board, because as far as I was concerned, you were the best choice, and it still is. I think you've proven that. Speaking about trust building, I would also like to make sure that Chief Fleury knows that the Métis Nation of Ontario would like to be part of your SOPs and stuff like that. Like to see the changes that you're going to be making towards Indigenous people and stuff like that. I have a couple of experts, a few of them actually, who can read these things and be able to dissect it and bring it back, and maybe we might be able to come up with some more ideas as well. So I just figured I'll leave it there for now, because there's a lot of people behind me here. So thank you very much, and I think you guys have been doing a great job.
Hi, I'm Cindy Long, and what I wanted to say is that it's not homeless people who make me feel unsafe in Thunder Bay. It's not Sylvia coming up to me at Bay and Algoma and asking for $5 because it's her birthday again. You know, I mean, that doesn't bother me. What makes me feel unsafe here are things like the guy flying the flag in front of his house on Balsam Avenue that says, F Trudeau, and if you like Trudeau, F you. That feels scary. That feels weird every time I drive past there. What makes me feel unsafe are the people who are targeting LGBTQ businesses and businesses that show signs of supporting the LGBTQ community. That makes me feel unsafe, that those people are out there breaking windows and doing those things. And what also makes me feel unsafe are people like the ones who opposed the Junot Street Transitional Housing Project. And they somehow felt empowered at a community meeting to boo the woman who was reading the land acknowledgement. And those people feel empowered in Thunder Bay to do that. So I guess my question is, what can we do to empower the LGBT community? What can we do to support, like massively support those in need of public services and affordable housing? And how can we overpower this fear that is making people act this way in our community? Because fear leads to anger, anger leads to violence, and that's what makes me feel unsafe, not the homeless.
So on an enforcement side, because that's part of your question, the unfortunate thing is people's rights. So they have a right also to demonstrate, whether we like it or not. We don't like the way they demonstrate, we don't like the way they behave, we don't like the way they perform, unless they're some kind of breaking the law criminally some way, then we can respond to it. If there's a hate crime, definitely we'd respond to it. We enforce that and pay close attention to that. I know just recently in the last few weeks, we did see another bit of activity in the LGBTQ community where there was some defamation of some property and stuff like this. So of course we're paying attention to that and making sure that, when it comes down to it, the very theme of this is safety, right? How do people feel safe? Everybody is entitled to be safe in this community. So we take these things very serious. We're going to look at those as we go along and have already, looked at some of the investigations going forward, and let people know that it's an awareness also for those people doing this. It's not tolerated. There's no reason for this. Yeah, you have a right to your opinions, you have a right to your ideas, but you don't have the right to go out and cause harm to people or destroy their property. So we're going to pay attention to that.
Couldn't agree more. I also think that it behooves some of the city's leadership to take some courses and learn that it's really wildly inappropriate to go to an Indigenous organization where an Indigenous land acknowledgement is taking place and thanking the settlers. Like, that's wildly inappropriate in this day and age. And so, I would really encourage city leadership to sit with Indigenous elders, sit in ceremonies, sit with the community, and sit with a textbook, for God's sake.
Your question, or your comments, I feel the same way. I don't feel unsafe at all with the people that we serve every day. But there are other things, and so your question about, what do we do about it? I think we have conversations like we're having tonight, and we continue with advocacy, and we give people who are marginalized we figure out how to amplify their voices to stop some of what we're seeing happening in our community. There's no easy answer, but I think, more conversation and, make our voices louder than those other voices, and speak up when we need to speak up.
Thank you.
I guess I would only add that, as I had mentioned earlier this evening, is ensuring that, we provide the safe space for people to express what they see as the solutions, or tell us what it is that they feel they need to be safer.
Thank you.
There are short people here. Hi, my name is Rita Jones, and I don't live in Thunder Bay. I used to. I do live in an environment where it is very unsafe, but that's not why I'm here. Why I'm here is to, there's an old adage, and it was First Nations. I'm not as eloquent, but I'll say it. When someone hurts, we all hurt. I liked Michele's comment. We have to have them become us. We are them. They are us. So I would like to know what you, in your positions, a number of us have danced in the disharmonious waltz with various levels of government, and we still rise above it, and I applaud you all on that. What are you as leaders and your organizations, how are you making them us? How are you making us them? Because they may have an issue, it's our issue. Like, if I'm judgmental, that's my issue. What policies do you have in place to bring everyone together? Thank you.
So one of the other objectives that we've set out is the community engagement, is being part of the community, being involved in the community. That's just not talking in situations like this. It's talking to all of our governments, having a good conversation as to what we're seeing out there in the community. We've been to a number of ward meetings. We've had a couple of town hall meetings ourselves, just to get that feedback, just have an understanding of what people are looking for, what people are concerned about, and what they want to see in their policing. So working from that, we have really solid conversations with the leaders and saying, this is where we're at, and this is where we need to go. And that's what I mentioned earlier about the support that we have, is because we're trying to make it so that this is all of us coming together, all of the agencies coming together, working together, and with our leadership and making sure that we're doing the right thing to help the situation in Thunder Bay.
If I could just clarify one thing. With the us, them, perhaps it could be stated slightly differently. What are your organizations doing to honor each and every one, to make them us, or to help them become us, help us become them? Like, am I making sense here? Like, the person that's hurting could be my brother out there. He is me, and I am him. How can I help him? How can he help me? Just understanding even. And where are the policies that are bringing everyone together? Not like being a leader says, yeah, we've got all these really neat programs in place, and yes, they are beneficial, they are doing good things. We have to reach down, like Michele said, what do they need? What do they want? They are us.
I understand you, and it's a great question. At my organization, our values and our mission that guide the work we do, we talk about serving people. And everyone who comes through our door is an individual on their own journey to recovery, whatever that means for them. And so our job, which is an honor, is to walk with them in that journey and to have some of those conversations about family connection and what do they need in their journey in recovery, and it's done without judgment. We don't turn people away. We sit with them in their journey and walk beside them and maybe pick them up when they need to be picked up. So it's not a policy. I think it's values, organizational values, and I will say at CMHA, I mean, we're very much grounded in advocacy right from the beginning, giving people voice, doing advocacy, so ensuring people have a voice. But yeah, we walk with people in their recovery journey.
Thank you.
So for Elevate, very similar to what Jen's saying, is probably more practice than policy. So it's just our personal beliefs. So and it sounds hokey to say. I'm really not this hokey, but it's unconditional love, right? So sometimes people come to our center and they are not their best selves, but we really, really believe in today is not your day, but I'd love to see you tomorrow. And I'll have somebody that I'm escorting out who'll be cursing and swearing at me, and it's like, I just really want to see you come back tomorrow. I'm never coming back again. And it's like, you know what? I will really miss you if you don't come back. And it's, I'm sorry, Holly, today was not a good day, right? And so I think that it's creating that space to be less than perfect, because we all are, and I sure as hell don't want to be judged on my worst day, which might actually be today. So I don't want to be judged on my worst day. And so yeah, what's the pathway back, right? So again, it's always examining our policies to always make room to have the conversation about where can we both do better next time. How can we make it so that you can come back? You can always come back. There is nothing that would prevent you from coming back. And then everything right down to the design, our drop-in center, that's like 100%. The people we serve, it's their design. It's not mine. I haven't had a good idea since 1994. So, but my clients, if I listen to them, they always steer us right. And so, yeah, so I think it's policy's great, but policies can shift depending on the leadership. But this is like at our core, it's our values, like you said. And so that's more of a practice than anything.
And I think just to add to that, you know, for myself, what's really important for me is making time and space for people and remembering that, you know, I can be anywhere tomorrow. I can really be anywhere tomorrow. And so in my privilege of leadership, allowing for time and space for people as much as I can, and remembering that, you know, it is a privilege, but it's a duty. And so, you know, I never like to think of myself as higher than anybody else in the organization of Fort William First Nation. You know, we are really all a team, and we're really all there for the people that need our service. So without all those folks, we really are not needed at all. So it's really an interdependent relationship. So as difficult as it can be to remember that sometimes when you are faced with challenging situations, really that's how I try to lead anyways. Thanks.
Thank you all.
Thank you.
Hello, my name is Chris. My pronouns are she, they, and I am the owner of the Loud Women Collective. I'm going to take us back to the rise of hate against the 2S LGBTQIA+ community, obviously across the globe and in this city. I have personally met with the mayor twice about this issue, and my question is for Chief Fleury. I would like to know what steps have been taken specifically since you were advised of this issue back in July when we first met with the mayor. What steps have been taken to keep the 2S LGBTQIA+ community safe, specifically trans youth?
Yeah, so again, going forward, one of the pieces that we're talking about is continual awareness of what's happening, paying attention to that. We have several of our officers have met with different people in the community to have a chat as to where things are going on a regular basis with some of the leadership. And these kinds of enforcement pieces, as they happen, we just got to pay attention to them. The other piece we want to get out there in the next little bit is have an awareness, like I mentioned, to there's no tolerance for this, and have people pay attention to what we're going to be doing enforcement-wise, and just making sure that everybody understands that we have a position on it. And again, everybody has a right to express themselves as long as they're not doing anything illegal.
Can I follow up?
Yeah.
Is anything being done about this United in Action group that's distributing the Druthers magazines in people's mailboxes, spreading misinformation and hate?
I'm not aware of that, so you have to educate me on that piece.
Okay, I can chat with you after, or do
Yeah.
you want me to say it now?
Yeah.
Yeah, there's far-right propaganda newspapers being dropped in people's mailboxes, showing up in local businesses like Maltese, Bay Village Coffee,
Okay.
on the res, as far as I've been told as well. Someone I know scooped up a stack from the res, and in this far-right propaganda, there's not only anti-trans rhetoric, but there's also things calling residential schools a sham. There's all sorts of misinformation in these newspapers that speak the truth, right?
So again, that's where we have to look at it. If they cross the line into something that's, criminal,
Okay.
we will take a look at it. If it's people expressing their opinions, whether we like it or not, it's unfortunate, but they have that right.
Okay.
Good evening. My name is William Burby. I live in Thunder Bay, Ontario. I've lived here since I was 17 years old. I've been in the community all the time. Little word here. Evil is uniting the people. Well, whatever. 2 years ago, Thunder Bay is not safe. 2 years ago, my wife was at the Pipes and Drums. She was going to the Biffy, and the guy come up to her, slammed her to the ground. She's still going to doctors and getting treatment and stuff. No reason at all. This man didn't have treatment. I found out later on from a guy that worked with him. He was a painter. He said he was a whiz-bang all the time anyways. So I'm suffering for this. When Bill Morrow was mayor, he used to have similar things as these. I went to a few of them if I was in town, so on and so forth. And things We had a lady on the city hall. She, every 3 months, she had an audit, of safety audit. It didn't do any good. I'd like to know what happened to our police department. It got ruined by some people that I know who did it too. And the person is still around, he's, and thing. So we ruined our police department. We had a mayor that was a crook. And what happened to the last police department? All this stuff has come out. It shouldn't have. Now, my wife was slammed to the ground. I'm still paying for her. She's going to three doctors and so on and so forth. She was 80 years old. She turned 83. She used to be able to walk at least 1,500 feet up and down the hill and everything else. Now, she's had a hard time to get in the truck. My son takes her out to her appointments and so on. So Thunder Bay is not safe. Now, further on, I've got a lot to say, but I won't say it because it's probably useless. The problem, you say that people are homeless. They came from somewhere. They come from up north. The big problem is when they get in trouble, they send them down here. And I'm not...
That's not okay. That's not okay.
Well, it's true.
Sorry, sir, do you have a specific question from someone on the panel?
My daughter-in-law...
That's an example of racism right there.
Well, say what you want, but you don't want to believe it.
No,
But anyway,
sir, I'm truly sorry for what happened to your wife. It sounds like an awful thing, and nobody should be a victim of a violent crime like that. But what you're saying actually is really at the heart of racism, and it actually is one of the reasons why our homeless population continues to grow over and over again. So I'd ask you to just maybe consider that, consider what we're saying, really think about that, and maybe do some work on that. But I really do hope for your wife that she gets better.
Are you saying I'm racist?
I'm saying your comment was.
It wasn't a comment. We needed help.
No, I'm not talking about that comment. I'm talking about you referring to people coming from up north because they're in trouble and getting sent down here.
Yeah. I'm not racist. My daughter-in-law was a welfare worker and so on, and she had a degree. She taught at the college, social work, and stuff like that. So I'm not racist. She sat down with me in an hour, and she put me straight on what lot of things happen. So yeah, sometimes, and police force was killed here.
Yeah, sorry,
That's
sir,
not okay.
I think we're ready for the next question now. All right, there's been no question asked. I think we should give other people a chance to speak as well.
Hello, my name is Andre, and as someone who works and frequents in the downtown area in Port Arthur, my peers and myself have witnessed on a weekly basis of instances where people drive intoxicated, experience issues when using substances like alcohol and others, and physical and verbal altercations. What we've also noticed is that there's a lack of supports offered or displayed downtown, and there's extremely little presence of local authorities in the area. So my question is, what can be done to reduce or mitigate these issues, and what can we as a community do?
Well, I work in Port Arthur. And I think there is a lot there. We definitely need more, but between Holly's organization, we're like a block apart or 2 blocks apart. But I think it would go back to Holly's example earlier of looking at what Vancouver has done and what other communities have done, and work with local businesses. So it's a vested interest for all of us. We want safety in each one of our areas in our community, but we can't do it alone. CMHA can't do it alone, and nor can Elevate, and it's not always a police issue. So to really have, again, dialogues like this, and then how do we come together in partnership with business and other organizations to increase availability of supports when people need them. We need to be on the streets more. I mean, Holly's organization and mine does a whole lot of that, but maybe too much. But yeah, to have that shared, and again, to have that respectful relationship between those who are struggling and business community and others I think we would see a huge difference.
And I think that there is an appetite within the business community. Certainly, we feel that over on the Port Arthur side, and I know that there's some talk with some of the people in the business community on this side of the city as well, where they don't want to just push people off. They don't want to be engaging in NIMBY, but sometimes problematic behavior is still problematic for business, right? And so they want to have solutions, and they want to do it in a really good way. And so I think that that there is an appetite for this, and we need to have more of these types of facilitated conversations where they can ask the questions in a good way and come up with some solutions that are good, viable options. So I'm actually really hopeful on that one, to be honest.
I just want to add one thing, just reflecting on what you asked. I think what we see is, again, related to discrimination. So I work late. My office is, in Van Norman, right across from Roosters, and I see people coming down St. Paul's, probably from the Sauve or the Tomlin, highly impaired. They get in their vehicle and they drive away. But then we have the other extreme of our homeless folks that we try and support, who don't go to the Tomlin, or they don't go home and have a couple glasses of wine because their home is the tent that they're living in. So I think we need to treat everybody the same. I don't have any more right to get in my car and drive or be intoxicated, and I think we see a lot of that because it's it's downtown, it's fun, there's lots of bars, but yeah, so I'm not sure if that made any sense, but it made sense in my head.
And just for us, you see something, call it in. Really, across the city, if there's some dangerous activity, we need to know about it in order to respond.
Thank you.
Thanks. I'll just have to step in and apologize to those who've been waiting very patiently. We're significantly over time for the evening. But if you do have questions, hopefully the panelists will stick around for a few minutes and you can come and ask them after. So we won't have any more time for the public questions. But I want to thank all the panelists for coming. I want to thank you all for coming tonight. It's been a very valuable conversation for us to have, hopefully the first of many. And this was an experiment for us at the library. So if you do have comments, feedback, questions, topics for future conversations, who you want to see on future panels, please send them in to us. Go to the library's website, send us the email. We're here for more engagement. We'll hope to have many more of these, but we need your ideas. This is not something that comes from us, but from the community. So thank you all for coming. Thank everyone for being here, and have a safe evening.